Okay. So let's start off with question number one. We have a left ureteral stent placement and then extracorporeal shockwave therapy or lithotripsy, which is your ESWL, of the left kidney are performed. So what CPT code or codes are we going to report? So let's look at this from a coding from scratch perspective. What is our main term that we should look up for this scenario? Any thoughts, main term? We have two of them. So we need to see whether or not the stent placement is included in the lithotripsy or vice versa. So which one do we want to look up first? Yeah, let's look up lithotripsy. Oh, underneath lithotripsy, what um, option are we going to choose underneath lithotripsy? Any guesses?
Kidney.
Okay. Yep. Yep. Okay. Let's look at the kidney option. So it gives us 580, 581, 50590, and 52353. So let's go look at the 580 and then 81. So 580. Oh, go ahead. Okay. So for the 580, that's for a percutaneous nephrolithotomy or a pyolithotomy lithotripsy with a stone extraction, antegrade ureteroscopy, antegrade stent placement, and a nephrostomy tube placement when performed. And then it also includes our imaging guidance. And then the difference between the 80 and the 81 is whether it's simple or complex. So does it sound like we did 580 or 81 here with these procedures, or do you think we should continue to look?
I would say no and look at the uterer.
Yep. Yep. The 580 and 81 are indicating that it's a percutaneous, right? We have here that we did it extracorporeal for that lithotripsy. Does everybody know what or does everybody know what extracorporeal means?
Nope.
It's outside the body. So the difference between, again, your 580 and 81 is your percutaneous, right? Where it's saying that we went through the body, right? Extracorporeal is telling us that it is outside of the body, is where those lithotripsy or those waves, those shock waves were emitted. So let's continue to look. Let's look at the 50590. So what's our 50590 code?
Lithotripsy, extra corporeal shockwave.
Yep. Yep. So that gives us our extracorporeal shockwave lithotripsy, right? Or that ESWL. So our 50590 is going to be for the lithotripsy only, right? And we need that LT because it's of the left kidney. Now we also need to report that we have a ureteral stent placement, right? From a testing perspective, we already know what our answer is because if we have to report that stent placement separately, then we know that our answer is D. But let's look at it from a real world perspective. And what would our main term be for the ureteral stent placement. Okay, Deisha says urethra. Well, okay, so be careful because urethra and your ureter are two separate body areas, right? The ureter is what goes from the kidney to the bladder. Your urethra is what goes from the bladder to the outside. Okay, so make sure that you're using your correct terminology there.
Okay.
Um, so okay, we can look under stent. Let's see if it's under stent. The main term stent. Underneath stent, I am not seeing an option for the oh, you know, I am. Sorry, I was not looking down far enough. So the ureter, yep. So stent placement and then ureter. Does everybody see that? So 50605. We'll take a look at those code descriptions. So 50605 is for a ureterotomy for an insertion of an indwelling stent, but they don't indicate that they did it in an open procedure, right? So we shouldn't report that one. Then we've got 52282. Five two two eight two is for a cystourethropy with an insertion of a permanent urethral stent. So again, this is in the urethra, not the ureter. So 52356. And then we have a parent code on the previous page. So it's a cystourethropy with a ureteroscopy or a pyeloscopy. And it is with lithotripsy, including the insertion of an indwelling ureteral stent. Again, that is not describing the lithotripsy. And we did not do a ureteroscopy. Or any of that. So 52356 would not be it. And then the last code in the alphabetic index is 5388 or 53855. And that's an insertion of a temporary prostatic urethral stent. Okay. So in this instance, place or stent and placement is not where we want to go. Okay. We actually want to go to insertion. Okay, because we're not just placing the stent. Usually a placement means that that placement is done in conjunction with another procedure. Okay. So we should go to main term insertion. Okay, because again, the insertion of that ureteral stent. So if we go to insertion and then stent and then ureteral, then that gives us our 52332, which is in the option that we have here. So let's go look at that code description for the 52332 so you guys can see what that code description should look like in order for it to match the procedure. So when somebody gets to the 52332, what is our, hang on, am I reading this right? Sorry, my brain is a little. What's our code description for the 52332?
The cystourethoscopy. But it does have the uteral stent.
Yep. Yep. So it's with an indwelling, it's a cystourethoscopy. Yeah, I know those words are kind of hard to pronounce when you're not used to them. So cystourethoscopy, and then with the insertion of that indwelling ureteral stent. So basically, it's going to be more of like a temporary stent, just in order to pass those stones.
Can you give me an index? Where is insertion? What page number?
Do you have the 2024?
Yes,
Okay, let me get your page number here.
because I'm not able to find insertion.
Insertion is starts on page 1196.
Okay, I found it. Thank you.
You're welcome. So any other questions on that one? So our 52332, we need a 51 modifier on it because it's multiple procedures in the same surgical session, right? Same area, and then our our LT, because it was done on the left ureteral stent. So any questions on that one?
Okay, so for from scratch, we looked up the lithotripsy.
Yep, you looked up lithotripsy for your ESWL. Yep.
And then insertion stent,
Insertion stent. Yep.
Okay. Thank you.
Yep. You're welcome. Absolutely. Okay. Let's take a look at number 2. So patient presents for treatment of your benign prostatic hypertrophy, or BPH. And then it's a urinary retention they present for the BPH, the treatment of BPH and urinary retention. And that was done by transurethral microwave thermotherapy, or TUMT. So what CPT and ICD-10 codes are we going to report? So Jacob, going back to your question, in this instance, our codes are already sequenced for us. But in the real world, you would need to look and see which one has the higher RVU. And the one that has the higher RVU is going to be the one that's first, that is listed first. Okay. So here we have BPH and urinary retention are our conditions. And then we have retention, or transurethral microwave thermotherapy, or TUMT. So do you guys, let's look at this from a testing perspective. Do you want to rule this out with ICD-10, or do you want to rule this out with CPT? Which one do you think you want to do?
ICD-10.
Okay. So which condition do you want to look up for ICD-10?
The BPH.
Okay. So what's our main term for BPH? So what's the condition of the benign prostatic hypertrophy? What's the main term or the true condition? Yep, hypertrophy. Yep. Let's go to hypertrophy. And then prostatic. And then what is our code in the tabular for our BPH?
Hypertrophy prostate. It says enlargement.
Yep. Yep. So we need to look at enlargement.
Enlargement. Yep.
Yep. Instead of. So let's go to enlargement.
Oh my goodness.
Okay. So enlargement prostate. And then is this with lower urinary symptoms or without lower urinary tract symptoms?
With.
Yep, because that's what our urinary retention is, right?
Yep.
Okay. So what's our code for width?
N41.
N40.1. Yep. Okay. And then once we're in N40.1, it's going to tell us that we need to also code what that lower urinary tract symptom is, right? So then that's going to be our urinary retention. So from a testing perspective, we know it's not D because we know we need a separate code indicating what that symptom is, right? So we know that's our R33.8 just from a testing perspective because it's in both. So then we need to go to our CPT and determine if that TUNT is described by the 53850 or the 52648. So let's go look at the 52648 first. So our 52648 is a laser vaporization of your prostate. So that's not what we did, right? We had termotherapy. So then let's just go look at the 53850, just to make sure. And then that code description for the 53850 is the transurethral destruction of prostatic tissue by your microwave therapy. So that's what we've got here is that transurethral microwave therapy. And then that termo is just essentially an additional word that they're giving us. Okay. Any questions on that one, looking at that from a testing standpoint? Okay. Let's look at number 3. So we have a partial cystectomy is performed due to the prior administration, due to the prior administration of radiation. It is complicated due to extensive adhesions and it requires an additional 2 hours. Okay. I know a lot of people's, what's the word I'm trying to think of? Instinct is to say, because we have an additional 2 hours and it was extensive, right? And it's complicated, would be to put your 22 on there. However, we need to look at our code descriptions first. So let's go look at the 51550. So what's our 51550 code description?
Cystectomy, partial, simple.
Yep. And then what's the 51555?
Complicated, post-radiation, previous surgery, difficult location.
Yep. Okay. So which one of those two do you think it should be? The 51550 or the 555?
51555.
Yep. So the main question is, do we need a modifier 22 with it? Or
No.
is right, because the complicated telling us that it's post-radiation, and all of those things, previous surgery, difficult location, all of that is included in that complicated procedure. So we should not report a 22 modifier with it because basically your insurance is going to review it and say it doesn't warrant any additional reimbursement at that point.
I totally would have put the 22 and moved on.
Right.
So
Right.
thank you.
Yeah, you're welcome. I know that's why I chose this one too, is because I like to make sure that a lot of people understand that just because they tell us that it's complicated and there's additional time doesn't always warrant a 22. You always have to pay attention to your code description.
I think the word extensive is what triggers me to like even make it more distinctive,
Yeah.
but
Yeah.
complicated is good enough.
Yep. But just make sure that like since it says complicated and then it includes the post-radiation difficult, right? Difficult location. There's a previous surgery, which is where your extensive adhesions would come from, right? All of that's going to be classified within that complicated version of the code.
Got it. Thanks.
Yep. You're welcome. Absolutely. Like I said, I put thought into which questions I pick out for you guys because I don't want to choose easy ones because if they're easy, then, that's not going to help you. But the ones that are tricky and complicated like these, I always like to make sure that you guys know kind of how to decipher them once you do see them, especially if you see them in the testing world. Okay. Number 4, we have a 63-year-old gentleman comes to the emergency department complaining of the urge to urinate, but has been unable to empty his bladder. The provider decides to place a Foley catheter to relieve the urine retention due to a prostate hypertrophy. So what is our code selection for the procedure and then our diagnosis codes? So how do we want to work this? Do we want to roll out ICD-10 or do we want to roll out CPT?
CPT, since we're already right here.
Okay. So which one do you want to go look at first? Well, I mean, I guess they're both they're right there next to each other. So let's look at the 51701 and 02. Okay. So what's the difference between the 51701 and the 51702?
Temporary?
Yep. One's indwelling and then one is a temporary. Yep.
Yep.
So we placed a Foley catheter. So which one is that going to be?
Temporary.
Yep, our temporary, because it even says it in there, for example, Foley. Yep. So we're going to rule out A and D. And then we'll highlight 51702. And then we see that the N40.1 is the same in both, right? So we just need to determine, is it R33.8 or R33.9? So let's come over to ICD-10. Let's go take a look and see if we can figure out from just a tabular perspective. If we can't figure it out from a tabular perspective, we can always go into the index where we can
I have a
sometimes
quick
get
question.
Yeah.
I thought that the R codes couldn't be a primary diagnosis. Like you can't have symptoms as a primary diagnosis.
Yeah. I mean, that's one way you can look at it too.
Okay.
Yep. Yep. Because our N40.1 is indicating that we have those lower urinary tract symptoms, right? Because we saw it up here too. So if we have those lower urinary tract symptoms, then that one should be listed first. Yep. Absolutely. That's one way to look at it. I've never even thought about looking at it in that way because that's just not the way my brain works. But yeah, if you remember that 100%. So our N40.1 is going to be that prostate hypertrophy. Yeah. And then the unable to empty the bladder is going to be either the R33.8 or R33.9. So then if we look at it at the R33.8 versus the R33.9, then we would use the other retention of urine versus the unspecified because we have, again, it's specified that they're unable to empty the bladder due to the prostate hypertrophy. So it's not an unspecified. Does that make sense?
Okay, in the book, it's highlighted in yellow.
The R33.9.
Yeah.
If so, in the AAPC version of the book, they just highlight the unspecified types in yellow just to kind of help them stand out a little bit.
Oh, okay.
So that you can see the difference between other versus unspecified. Yeah. Okay. Any other questions?
Speaking to the highlighting, does that also equate to like the green highlighting with the code descriptions, meaning another code is needed, like you need the symptom?
Um, to be honest, I'm not 100%. No, not necessarily, because I'm looking at some of them, and like if you look at that first column that's over there, for the R29.73, I think the green is just kind of like that detail.
Okay.
Because you've got some of them that are other, but then you've got like R35.1, which is just straight nocturia. That's not going to be an other. In your NIHSS scores, you've got the numbers that are highlighted or that are like in that green font. So it's not necessarily they're always others. I think it just kind of helps highlight those words that mean something different in each one of the codes, right? So like in the R, let's just say the R, 31.21 versus R31.29. They're both hematuria. So the hematuria is in just your regular black font, but the 21 is asymptomatic, and then your 29 is other. So in this instance, the other is just telling us that it's different from the drug induced, right? That's just telling us it's just kind of that word that's standing out a little bit more. That's the way that I'm reading it. There's not anything specifically that tells us what that green text is, but that's what I would say it should correlate with. Okay. So number 5, we have a 68-year-old male that is admitted for left flank nephrectomies with partial ureterectomy. He has a left renal atrophy and chronic renal inflammation. The pathology report reveals that there is marked glomerulosclerosis, chronic inflammation of the kidney, renal pelvis, and the ureter. So how do we want to work this out? Do we want to roll out with ICD-9 or ICD-10 or CPT? I don't even know where ICD-9 came from. Do we want to roll out with
ICD-10.
Okay. All right. So how do you want to rule it out with ICD-10? Tell me what your thought process would be.
Look up glomerulosclerosis
Okay. Yep.
first.
So, yep, go in your index. That's the way I would do it. Because that way it's going to kind of narrow it down a little bit easier. So glomerulosclerosis. Okay. So then it's telling us to go see what instead of the glomerulosclerosis. Sclerosis and then renal, right? So if we go sclerosis and then
Sclerosis.
renal, yep. We don't have any other information as far as whether it's cystine storage disease, hypertensive heart disease, or whatever that word is. I can't say it tonight. Right. So we're just going to go with our default code, right? So we've got N26.9, which that's in 3 of them. Where else do we want to go? Say that again, Dawn.
Nothing.
Oh, okay.
No, I'm talking to myself. I asked
No,
something
you're fine.
like
You're fine. I just wanted to make sure because I know sometimes like everybody's microphones will get a little muffled if you have your book too close to your computer. So I wanted to make sure you weren't saying something and I should be acknowledging it.
no.
Okay, so where do we want to go? I would go to the inflammation next, right? So we've got inflammation of 3 things: the kidney, the pelvis, and the ureter. So let's go to inflammation. So here, okay. So this is where the index isn't really going to help you a whole lot because there's not two of the three aren't in there. You don't have a renal pelvis and you don't have a ureter option. So what I would do from there um, is go look at your kidney, right? Because your kidney's telling us to look at nephritis. And we know that we only have one code that we're going to have to report, right? It's going to be one of our N codes as well. So let's go look at our nephritis, see what that code is going to be. And that's what code?
I'm not sure. You said go to nephritis, but then what?
Yeah. So nephritis, and then, so what other information do we have, right? So we have chronic renal inflammation. So nephritis is going to be our renal inflammation, and then we would go down to chronic, right? And then what's our code underneath chronic? Because we don't have any additional inflammation or any additional information besides chronic inflammation of the kidney. So that code is what?
N89.89.
No, you're probably
3.9.
under, yeah, it's going to be N03.9. So I'm looking to see where you might be with that N89. I'm not even seeing an N89 in the alphabetic index. So I'm not sure where you're at with that N89 code. So make sure you're under main term nephritis. And then underneath nephritis, you'll go to chronic. And that gives you your N03.9, right? So we can go if you want to. We know that your N03.9 is an option. Okay, so let's go look at N03.9 and see if that includes the renal pelvis and the ureter as well. So if we were looking and we were just going straight to our tabular, right, where a lot of people do that with your ICD-10 to rule out, if you would have gone straight to N03.9, you probably would have skipped N03.9 because that's telling us it's chronic nephritic syndrome with unspecified morphologic changes, right? That doesn't sound anything like chronic inflammation of the kidney. But that chronic nephritic syndrome, that is going to include that inflammation of basically all of the organs within the urinary. So the kidney, the urinal pelvis, and the ureter. So our N03.9 is our correct code. Actually, no, I'm sorry, it's not. I take it back. Your N03.9 is not your correct code. Sorry, I was looking at this wrong. Let me look at this one again real quick. Make sure I'm not missing a key term. So patient is 68-year-old male, for left nephrectomy. With the left renal being chronic renal inflammation. Okay. So I'll be honest, I'm not sure why It's not your N03.9. I'll have to look into this one a little bit more. But so if you get to this point and you're stuck on your ICD-10, okay, we still have it narrowed down, right? We only have two CPT codes. We either have 50220 or the 50230, right? So let's go look at those and see, because sometimes you just get stuck, right? Sometimes you start to overthink it. So let's go to the 50220. And what is our code description for 50220?
The nephrectomy with the partial.
Yep. So we did the nephrectomy with that partial ureterectomy. And then what is our 50230? It's for a radical, right? So we know that we did not have a radical, right? Because it just tells us that it was that nephrectomy with partial ureterectomy. So our 50220 is our correct code. So we were able to somewhat narrow it down, right? But we just use our CPT to help us narrow it down. I'll have to look and see if I can get a clearer explanation as to why it's the N03.9 versus that N28.89. Because I'm not 100% confident on that rationale that they gave us that it should be that. So I'll have to look into that a little bit and I'll get that posted. I'll get a clarification and an update posted if it's going to change. If it's not going to change, then I'll give you a clarification as to why it should be that N2889 versus the N03.9.
Does it make a difference if we go disorder?
Yeah, that's what I was going to ask too.
Where do you see disorder in the question that would
Just
guide you
disorder
to
in
it?
the kidney, and with all the other structures like pelvis and ureter. Would it make a difference if we went disorder in the index and it comes to that code maybe?
Oh, let's see.
I don't
Well,
know. I
it's
haven't indexed
be
it
the
yet.
N28. Let's look at what N28.89 is. Let me see if that'll help my brain comprehend it. Like I said, I'm not really on my P's and Q's for like completely like I normally would be. So N28.89 is other specified disorders of the kidney and the ureter.
Does it matter which N code comes first?
According to our code descriptions of the N26.9 and the N28.89, no, it would just be what they were mainly being seen for.
Okay.
Yeah.
Okay.
So yeah, with your chronic renal inflammation, no, the N26.9 was the glomerulosis. Sorry. Let me look at this one a little bit further so that I don't keep talking in circles and confusing you guys while my brain is trying to comprehend them. And then when we meet next week, I'll give you guys an update on why it should be one or the other. Does that sound okay?
Yep.
Yes.
Yeah, it didn't. Yeah. I mean,
Yeah, I'll give you guys a little bit more clarification on this one next week. I'll work on it and get some clarification and then give it next week. We'll start out with why it should be and how we would accurately get to that code description and everything like that too. So within the tabular in case you're wanting to look at it that way. But
Okay.
I apologize for not being on my normal P's and Q's and thinking clearly tonight. It's just been one of those days. So I'll go ahead and we'll go ahead and end, and then next week we'll pick up because I wouldn't even want to spend only just 15 minutes on the genital system and all of that and the reproductive system. So we'll just do next week. We'll do the reproductive system. So questions 6 through 10 next
Okay.
week.
Okay.
And if you guys need anything in the next week, then just let me know. Okay.
Okay.
Okay, sounds
great.
good. Feel better.
Thank you so
Thank
much. I
you.
appreciate it.
Feel
Y'all have a good
Thank
night.
you. Thank you.
Bye, Tiffany. Hope you feel better.
Bye. Thank you.
Bye.